In this country of ours took place the greatest revolution that has ever taken place in world's history, the only true revolution. Every other revolution simply exchanged one set of rulers for another. But here, for the first time in all the thousands of years of man's relation to man, a little group of men, the Founding Fathers, for the first time, established the idea that you and I had within ourselves the God-given right and ability to determine our own destiny. This freedom was built into our government with safeguards.
What they'll say is, well, it costs too much money. But you know what? It would cost about the same as what we would spend over the course of 10 years. It would cost what it would cost us. All right.
Many are mad because Nadia Suleiman is an unemployed single mother in debt and on food stamps, who already had 6 children. Taxpayers aren't happy about paying for these babies, too.
Her actions were so reckless and irresponsible that the taxpayer is going to have to pay probably between $8 and $10 million in their money to get these children out of the hospital and through their first year of life. And then probably a lot more after that. Her actions were reckless, irresponsible, and she's using taxpayer money. She has no medical insurance that's paying for these children, so we are paying for their medical care.
Sometimes when we have that dream and that passion and we take risks, and I did, and it turned out perfectly.
My idea of welfare reform is it's over. I saw 37.8 million Americans living under poverty. Really? They're smoking, they're drinking, they got the bling bling, they got the cell phones, the children got the iPods, they get their hair done. I don't get my hair done. They think that making ends meet includes movies and pets and collectible dishes on the wall. It isn't even McCain and it isn't even Obama. The real curse in America is the abject apathy of a we the people who don't even know they are the people. They have no connection as long as they have a six-pack and a ball game to watch. They could give a rat's ass what's going on out there as long as they got a little bit of the paycheck yet. They haven't taken it all yet.
One of the traditional methods of imposing statism or socialism on a people has been by way of medicine. It's very easy to disguise a medical program as a humanitarian project. Most people are a little reluctant to oppose anything that suggests medical care for people who possibly can't afford it.
I'm here today because I don't want our children and their children to still be speaking of a crisis in American medicine 50 years from now. I want them to benefit from a healthcare system that works for all of us.
Healthcare is your big issue, and you believe that Americans, by their birthright, should have government-funded health care if they can't afford it. Their birthright dictates that, correct?
Yes.
Okay. Do you base that on the Constitution, or do you just base that on you being a nice person?
While it's not in the Constitution, and many social programs that we have aren't based in the Constitution, I think that as the wealthiest nation in the world that we
so it's more of a thing that we have a lot of money and we should spend it in this way. Do you believe that every American by their birthright should have a decent home? Because if you don't have a decent home, chances are your health isn't going to be very good. Does the government owe people who can't afford a nice place to live? And I'm not talking a luxurious condo. I'm just talking a decent home. Do you believe they should have a decent home?
Yes.
Back in 1927, an American socialist, Norman Thomas, 6 times candidate for president on the Socialist Party ticket, said the American people would never vote for socialism. But he said under the name of liberalism, the American people will adopt every fragment of the socialist program.
We have a catalog healthcare system in this country. We pay a lot for it, but we get a lot for it, whether people want to admit it or not. It is a Cadillac system, and it is going to turn into a Yugo system, and very, very quickly. We do have the best health care in the world, but that doesn't mean the whole world gets to participate in it, because it'll break it and destroy it for those of us who subsidize it.
The reality is that with all of its infirmities and difficulties, we have the best health care system in the world. And it may be because we have a system that still is, if not wholly, at least in large part, still private. To go in the direction that the Democrats want to go, much more government care, much more government medicine, socialized medicine, is going to mean a deteriorated state of medicine in this country. If we go in the direction of socialized medicine, where will Canadians come for health care?
The truth is we can get everybody insured in a free market way. We don't need Hillary care or socialized medicine.
There's no proof that single-payer socialized medicine has ever been beneficial. I mean, that's why in Canada we find many people leave and come here, because we do have more freedom here than they have in Canada, and you don't have to wait in lines. We just have the problem of cost.
How are the pharmaceuticals possibly going to lose in this scenario?
Well, you have to understand the United States is the last country in the world in which pharmaceutical companies can do research and development for these new innovative drugs that come out and save lives and make all of our lives easier. The reason why they can't do it in other countries in the rest of the world is because other countries have slapped price controls on pharmaceuticals and have said you can't charge enough in order to finance research and development. Inevitably, what will happen as a result of the government taking control of health care in America is they will start to say to these pharmaceutical companies, we are not going to let you charge what you need to charge in order to finance research and development.
Exactly right.
Government interferes too often. We become complacent and depend on the government to protect us, and they fail, and they don't provide the services that they claim. You know, we've had the government involved in our medical care system since the early 70s. We've had managed care, and all of a sudden nobody's happy with it. So now the choice is, did we have too much government, or do we need, you know, a single payer? Should we move toward a socialized system, or should we look to the marketplace to help us sort out the problems we have in medicine? My argument, of course, is always looking for the answers in the free market, in private choices, and individuals dealing with those problems, rather than depending on the state, which generally will support maybe the special interests. Like today, too many corporations benefit from our medical care system.